Dr. Renée, take it away. Oh, it rhymed. I'm a poet and I didn't know it.
Thank you. So, claiming that men can have ovaries is not only degrading to women, it's also dangerous. This week, the charity Ovarian Cancer Action decided to kick off Pride Week, Lord knows why, they're an ovarian cancer charity, by asking the question, can men get ovarian cancer? They followed it up, because it needed some explanation, obviously, to say that anyone with ovaries, regardless of their gender identity, can be at risk of ovarian cancer. I won't bore you with the rest about genes. So you get the idea. We need to now think about men and whether or not they get ovarian cancer. I'm sick and tired of this gaslighting of women by making them buy into a delusion and deny that there's anything unique about them. Women are unique. We're unique because we have ovaries. And from those ovaries can spring potential men and women of the future. And it's only the fact that they are women that they have ovaries. Now, if we boil this quote down, yes, of course, there are some women who decide to present to the world as if they are men. In all intents and purposes, everyone must believe they're men. But biologically, they are women and they have ovaries. And that's the important fact here. So let's just think about why it's dangerous. Up to 40% of women don't know they have a cervix. So if you reduce them to a woman with a cervix and then you call them forward in that way for their cervical screening for a very treatable cancer of the cervix, 40% of them won't come and are potentially at risk of dying because of this delusion and making men feel happy. I'm sure that the same applies to ovaries, because if women don't know what their cervix is, they probably don't know what their ovary is. So the only way to keep women safe is to actually and stop them dying at the altar of hurty feelings, because let's face it, that's what we're talking about, is to call them women.
How do 40% of women not know they have a cervix?
Do you know, you'd be surprised at people's medical knowledge, Albie. I mean, I'm in GP every day, and people often don't know things that we would think of as really straightforward things. People don't know sometimes what renal means. We call it a renal function.
Is that liver?
Explain it's kidney.
Kidney.
You see? Finish.
Illustration A. Never mind. Ella, where are you at on this?
I mean, in terms of the realm of medicine and biology, the key has to be, the number one focus has to be clarity. There can be endless dangerous consequences from mixing up the political realm of debates about gender identity, whatever side you fall on that, with the fact that when you step into a GP's office or into a hospital, you're not a citizen in the political world anymore, you're a patient, and you need to be treated as a patient, and the most important thing is your sex, whether you're a man and a woman. That's why we have different blood tests. It's why we have different responses to medicine. I mean, if we were pretending like we were all the same and all that mattered was the name that we put down on the form, then people would be dying because you wouldn't be treating people properly. And I think, I mean, you used the word gaslighting, Renée. I think the most infuriating aspect of this is that we're told that if we want to speak in terms of truth, that men are men and women are women in a biological sense when it matters, that there's something wrong with that, something mean about that. You term dirty feelings, or that it's cruel, and it's the idea that doctors and nurses and staff in hospitals are being cruel by telling the truth is ridiculous.
It's absolutely ridiculous.
Benjamin Butterworth.
But I think the failure to recognise some of the services that a transgender person would need, someone who appears to be something that's not how they were physically built, also has serious consequences. So Ian Duncan, who's a Conservative member of the House of Lords, his brother, who was born his sister, died of ovarian cancer. And it was because they were not invited to have checks that was able to get out of hand for that to be possible.
Okay.
Because nobody was asking this person that looked like and was referred to as a man. Nobody had acknowledged the fact that they were physically a woman.
Does that not back up what Renée
I think you've just perfectly made the case.
But they're not a woman, they're a man.
No, they are a woman, biologically, and that's all that matters in medicine. And when biological women are allowed to have their medical notes changed so that the GP who sees them has no indication whatsoever that they are dealing with a woman who looks like a man and says that they're a man, why would that GP ask them about their ovaries? Why would they ask them if they had any symptoms of ovarian cancer? Who is the responsibility with? Once somebody's taken the decision that they no longer want to be seen as a woman, It's their responsibility. They know they're a woman deep down.
But that's the point of this campaign that you started your monologue with, which is that they're saying anybody with ovaries. Now, in this case, that's a person that, recognises themselves as a man, but they also have ovaries.
It's a woman. And they know they're a woman, Benjamin.
also-
They know.
Well, they don't.
But also, no one ever.
They do.
Why are there never campaigns saying anyone with testes?
Yeah, or a prostate.
Or anyone.
Prostate, yeah.
It always. I think we have to acknowledge the
there's
political bias here, which is that this always centres around women and women's services having to give room to anybody. There's such a great word, anybody. I mean,
All right. We're going to
it's
have
not
to,
fair.
unfortunately, leave that one there, but I think that could have went on.